Melly, would you like to kick us off?
All right. Well, thank you everyone for joining tonight. You are joining us on the Taking Action on Lead Poisoning, a conversation with parents and lawmakers. The webinar tonight is being brought to you by the Ecology Center and the Great Lakes Lead Elimination Network. In the photo here, we have lists of several of our partners. We have over 30 partners around the Great Lakes that are joining us in the fight to end lead poisoning. We want to give a special thank you to our National Lead Poisoning Prevention Week Planning Committee. They have spent hours planning and ensuring that we have a robust webinar this evening. So we want to give a special thanks to CECOL from Ohio, Healthy Homes Coalition of West Michigan, Clean and Healthy from New York, Learning Disabilities Association of America nationwide, and Sam Pickering from MEC in Michigan. So a little bit of the agenda for today on how it's going to work is our parent advocates are going to go first. We're going to get the opportunity to hear directly from parents who have been impacted by lead poisoning, whether it's themselves, their families, their children, or in their own state. And so we hope that you can hear their stories and you can take note and you can ask questions to them later on. Once our parent panelists go, we will have our lawmakers from various states who are going to be joining us today have the opportunity to spend about 5 to 6 minutes talking to you today about current lead legislation, some policy wins, and what you can do to take action. Finally, we will have a question and answer. So you can go ahead and continue to drop your questions to any panelist you wish, or just generally, and we will get to those questions. There is no right or wrong way to ask a question. This is the opportunity for you to speak up and ask. This is a time for you to ask whatever it is that you want to know about lead poisoning in your state, or what you can do about it, or how it's affecting you and your family. So, any kind of question you'd like to ask, please do. Jamila at the end will then lead a networking opportunity, and she'll talk a little bit more about that after. That's going to be 15 minutes after the webinar has ended. So, for all of you who can stay on, by all means, we totally encourage you to do so, as Jamila will be leading that. So, without further ado, we would like to start with our first panelist, our parent advocate, Robin Brown from Ohio.
Good evening, everyone. My name is Robin Brown, and I have been an advocate for the fight of lead poisoning since 1999. It's given me over 2 decades of advocacy work, but first it gave me opportunity as a parent to learn what the problem was. My daughter was severely poisoned with the 70 micrograms per deciliter, which is equivalent to a coma, death, or seizure happening at any moment or second. For me, I did not know what I know now, and I was lost. When I received the phone call to have me directly admit my daughter to the hospital to receive chelation therapy, which is a way to bring the lead down in a child's body, there's no treatment for lead itself, but chelation does help in an emergency state where my daughter was. So having a 5 day stay in the hospital, being left alone for over 10 years with no case management follow up. We did not receive, my doctor never showed. Even though she was admitted in the hospital, we were left alone. It was another family member, a mother, who helped me gather the knowledge, the know how, gave me opportunity to start sounding the alarm bells because in 1999, lead was not being talked about. Lead poisoning of our children, the state of where we were at a silent epidemic plight was not being mentioned, as well, not seeing it as a global action or framework for anyone taking advantage of it. So I would say for my work and for my time, it has been very much important to get the awareness out for lead, to just let people know this is still existing, it's still happening, it still is affecting our children at the severity that it always have. A lot of people thought lead was gone, that lead was no longer taking place. So even back in 1999, people felt that lead was not a problem. It was not an issue. But we know today, even here in 2020, 2025, it is still prevalent in our families, in our children. The poisoning really can devastate our children. For me, being that my daughter was poisoned, I personally wanted to focus on what lead does to the human body. What does it do to our children? What is taken from our children? Um, a theory that we used was if we put back what lead takes out, so for example, loss of IQ, if we constantly put early education into my daughter space, will that help her? Well, the results is yes. My daughter carried the 3.47 average in grade school, even though she lost over 7 IQ points with her poisoning. She was able to maintain her grade point average at 3.4 and above. She is currently a graduate with her master's. She's very productive in society. And so I don't like the term myself, leaving our or labeling our children as canaries or canaries left out of the mine. I don't believe that. I believe that our children is our babies, and the first sign of lead, we should be proactively working with the children as well as the family because early prevention is a lifeline for our children.
Perfect.
And
Thank you, Robin.
Thank
thank
you,
you.
Robin.
Thank you so
And
much.
next, we have Darlene Medley. Darlene Medley is from Ohio.
Well, actually,
I'm sorry,
no,
from New
I'm
York. I'm
sorry.
sorry. I see Rep Jarrell's. I'm like, Ohio, Ohio. She
Yes.
is from New York. So let's welcome Darlene Medley.
Good evening, everybody. First of all, thank you all for doing this. Thank you all for being on here on a Monday night. You know, it is dinner time. Everybody sure has kids, whatever the case is. So I definitely appreciate y'all putting more of a spotlight on lead poisoning. Um, I began this journey as an advocate when my twins, who are now 9, were 19 months, and I was told that they were poisoned by lead. I was given some nutritional facts, I guess you can call it, and a Section 8 voucher, and left to figure everything else out on my own. A lot of people don't never hear me say this, so you guys are privileged to be the first ones to ever hear me say this. But this is truly generational for me and my kids because I'm from Brooklyn. And if you look at Everybody Hates Chris, there's a whole episode. It's called the Lead episode. Look it up. That's I went to all those schools. So my brothers and I were poisoned as kids. It was not that big of a deal. It was, hey, they gave us. I remember they gave my grandmother this big, huge brown bottle of iron. I want to say, and some other medicine. And they told her to give us this medicine. And hey, we were going to be okay, right? Again, I never advocated for it because I wasn't aware of the symptoms and what it was doing to myself nor my brother. So now, fast forward all these years later, my twins ended up being poisoned by lead. Now I have a 27-year-old who I just found out has a high lead level of a 27. There's no resources. No resources up here in the state of New York. Absolutely none for us. We have no protections at all. We are literally going from one crappy apartment to another crappy apartment in hopes and prayer that our children are not going to be poisoned. Our children up here, unfortunately, are getting poisoned now, not only by the paint, but by the water. And because nobody wants to take accountability nor responsibility, they're trying to, oh, look, it's nothing going on up here, even though the same person that did Flint's water report, Miss Ellen, I believe is her name, is the same one that did Syracuse, New York's water report. Everything that we said, she backed. The EPA backed everything that we said and what the Miss Ellen said, right? So now we have all our facts in line. So you would think that Syracuse would be heading into some type of class action suit against the city or the county. We're not doing that, unfortunately, because here everybody's friends with everybody. So, if you my friend, I can't step on your toes. Even though we're poisoning children. Even though we're poisoning children, I can't step on your toes. So this is what happens a lot here. Like, I have a 65-year-old that is literally living in the trenches of where it's the highest lead rate right now. If you Google Syracuse, New York, and you was to Google what is going on, you'll see that they're taking down what's called the Pioneer Homes. A 65-year-old with a 65 lead level that can't get resources. Because why? She's out of the threshold. So our numbers probably this year are going to look, right? They probably going to look good, right? But what nobody's going to talk about is that 27-year-old that I met, the 65-year-old I met, my friend that has an 11-year-old son who literally was in his room. He ended up catching a really bad case of pica because he's in his room literally eating the chips from the paint. And because I've been around lead so much, I don't know if any of the rest of you can, but I can smell what lead looks like. This mother called me with her 11-year-old son. It was about 7 o'clock on a Friday. I'll never forget it. And she was bugging out. She didn't know what to do. I immediately stopped everything I was doing to take her a water filter and to take her a sticky mat. So this way she could, at least make sure she had clean drinking water and wasn't bringing lead into the home. And when she showed me her son's room, as soon as I entered the room, I smelled the lead. And I said, no, it's lead in this room. You got to get your son out this room. It's lead. I can smell it. It smells like a sweet metal, if that makes any sense to anybody. But like my throat will start itching. I start doing, that sound that. So you got to clear your throat. Like it's like allergic reaction to me, and I'm encouraging my children to go get tested. And in all honesty, y'all, I really need to be encouraging myself to go get tested. I'm just really terrified because I know my 27-year-old, he came up with high lead levels and he wasn't around the lead as I am. So I can just only imagine what my numbers are. But then in the same breath, we're also facing, I just sent my 21-year-old to go get tested at the local health center. They told him he has to wait until the lead van comes back out, which isn't until April. That makes no sense. No sense. But these are the things that we are still literally in Syracuse. I hate to say it, we are still at the drawing board. We are still at the very, very beginning, trying to figure out who is lead poison, who isn't lead poison, what's going to work for them, what isn't going to work for them. And we've been at this. I know myself, I've been going to them saying, hey, I'm an affected family. I know what works for me. This is what I need. If you give me this, I can do this. I have never gotten anything I've asked for. Never. I'm literally working with my twins. My one twin, my one baby has overcome a lot. He really has. I'm going to champion this. Because he came and he said, he had a stutter and my baby stopped talking for quite some time. My baby didn't talk for almost a year, besides the people in his family. Okay. And I kept encouraging him. We learned about James Earl Jones and how he played in Lion King. And we learned that James Earl Jones actually had a really bad stutter as a kid. A lot of people didn't know that. And me and my son, we looked it up. And one day I get a call from the speech teacher, man. And she was like, hey, I don't know how you're going to feel about this. She said, but Rashad came and he said that I don't want to do speech no more. And if the people can't understand me and if they can't wait for me to say what I got to say, then guess what? That's their loss. So I'm championing the hell out of that, y'all. I am, because I know that comes from Glenn family pushing me and encouraging me to keep on encouraging my children, other lead advocates who I've run into, other families I've run into. So to my Glenn family, I want to say that we might not always see it, but we are doing it. We really are. I want to keep everybody on here encouraged. To the lawmakers that's on here, please, I hope that you go back to the table and really advocate for us and really fight for us, because all we asking for is to be treated like decent human beings. and not even us ourselves. We're asking for our children to be treated like decent human beings. They deserve to be lead free. They deserve to have a home where they have good quality drinking water. It's just right. It's a human right, you know. So for us to still again be at the very beginning of the table is disheartening for me. It does hurt me. It does make me angry, but I'm learning to not approach it angrily, to make sure they understand and hear the message without the anger. So again, I definitely appreciate all of y'all, and I hope we really can combat this lead poisoning this year.
Thank you so much, Darlene, for sharing your story. We know that that's not easy to do. We all have a story about lead, and this is just an incredible way for you to be able to speak up, share what you're thinking, share what you're experiencing, and what's going on in your state. So thank you, Robin, and thank you, Darlene, for doing that. Next, we have Rep. Rogers from Michigan.
Thank you so much. Thank you to the Ecology Center and the Great Lakes Lead Elimination Network for bringing us together and for the stories that we just heard. That's really powerful. Your leadership is really amazing and inspiring. And I would just like to say that I represent Kalamazoo in Michigan. It's House District 41, but I'm a physical therapist first and a lawmaker second. And why I'm so passionate about lead poisoning and lead poisoning prevention is I have had several dozens actually of my own patients over the years, both young people as well as adults that have suffered from neurological conditions. And often the physician didn't necessarily pick up on what was happening. They would notice some neurological things and then send them to the PT to rehab. And oftentimes I'm trying the usual things that I know in my toolbox for neurological conditions. And then when people are not advancing, I'm calling the physician to say, hey, have you considered heavy metal blood panel test? And oftentimes I'm kind of like the detective figuring out what's going on. So that's happened way too many times. I am in this privileged space to be a lawmaker where I can do something about the laws. I was a county commissioner before a state rep, and I was a county commissioner when Flint water crisis hit. And I wanted to look at the Kalamazoo numbers to compare us to Flint. And I was alarmed that we had equally high levels of children testing positive for lead, not because of our water supply, but because of the old housing stock. And I tell my colleagues, I think every lawmaker has pre-1970s housing stock that they need to be paying attention because that is actually one of the most common um, sources of lead poisoning. So last term, I had the privilege of being the health policy chair in the House, and I wanted to just highlight a few of the bills that were successfully signed into law by our governor in Michigan that went through my committee that I prioritized on my agenda. So one of them was requiring universal blood lead screening for all 1 and 2 year olds. So this has been a practice that Medicaid coverage already was happening in Michigan, but it was inconsistent and it was confusing to people. And so these two bills that we passed last year were to require both Medicaid and commercial insurance companies to pay for universal screenings. So that was Senate Bill 31 by Senator Cherry and House Bill 4200 that made it across the finish line. We're very excited about that. And then the other package that went through my committee was for Filter First. And Filter First basically requires filtration on all drinking water in our public schools as well as our daycare centers to make sure that our children have access to safe, clean drinking water at school. And that was House Bill 4341 and 4342, as well as Senate Bill 88. So that was really exciting. This is my third term working on lead bills, and the package I'm about to outline got through the House and died in lame duck in the Senate. So we picked up the package again and added one new bill. So just wanted to quickly outline the four bills. It's House Bill 4864 through 7. My bill is to update Michigan law. While there's, of course, no safe lead level, there's thresholds that trigger actions. And so in Michigan, our law is kind of archaic and old, and the policy is 10 microdeciliters before action is taken, and the CDC has put it down to 3.5. So my bill just aligns Michigan with CDC guideline of 3.5 microdeciliters for action. The new bill in the package is my Republican colleague. I thought it was really important to be bipartisan because we have divided government this term, and so I want these bills to get over the finish line. So it's a bipartisan package, and I encourage anyone on this call, if you're working on legislation, to try to make it bipartisan if possible. But Representative Jamie Greens is requiring baby food manufacturers to test for toxic metals in Michigan. Shockingly, baby food is actually in some areas showing up positive for lead. So this requires Michigan manufacturers to test for toxic metals, remove that product from sale if it fails, and then add a QR code on the label of the baby food so that the consumer can scan the baby food in the grocery store and see what the label says. My colleague, Representative Donovan McKinney, has a EPA renovation, repair, and paint rule to codify into Michigan law the EPA rules about using certified lead safe practices for remediation. So if you have a home that's pre-1978 and it has lead paint, you must follow the EPA rules and regs for mitigating it and cleaning it up properly or face steep penalties and fines. And then the last bill in the package is an automatic referral to early on. In Michigan, we have an early on program for kids that are testing positive for lead before age 3. Then they're automatically referred to services, and the parents are well informed about what they can do for their child and what programs are available. I think the,
Excellent.
do I have one more second?
Yes, you
The
do.
last thing I'll wrap up and say, things you can do in your own state is contact your lawmakers about your personal stories. There is nothing like sharing your personal story to change hearts and minds. So I encourage everyone on this call to reach out to their lawmakers and share their stories. And then to take a look at what laws are going on in your state and uplift. And I'm happy to share. I've copied bills in other states before. So if your lawmaker is interested, I'm happy to connect with other people and share what we've done in Michigan. Thank you so much.
Excellent. Thank you so much, Rep. Rogers, and congratulations on all your work. We notice it here and we are so proud of everything and just continue to work on next bills and some more wins in our state. Next presenter that we have is from Ohio, Rep. Dontavius Jarrells. Welcome.
Well, thank you for having me. Hey, everybody, how you all doing today? I am so excited to be here on this call. I too want to thank the Ecology Center and the Glenn, or Great Lakes Lead Elimination Network, for bringing families and policymakers and leaders. I don't know who's all on the other side of this call. It's like 44 folks, but hello. It's so good to see you. Um, so, as was stated, my name is Dontavius Gerald. I just so happen to be state representative representing here in Ohio in House District 1. I always say the best one when I'm by myself. I represent Columbus, Ohio, but I am originally from Cleveland. And my intersection into this space is very personal. I am one of, if not the only member who has ever been elected who was a lead poison survivor. When I was about 3 years old, 4 years old. We lived in a very old home, and my grandmother, who was born in the 1920s at the time, had antique furniture. And who was it? Who said it? It was not Robin. I think it was Darlene who said that for me, when you have old furniture that's have lead, there is a sweet smell or taste to it, and that is what attracts kids, as many of you will know on this call, to consuming lead. Well, I was one of those kids. I was, watching underneath the table, this old table, eating these lead chips, watching sci-fi movies with my grandmother, not knowing the poison I was putting in my body, and it had a impact on me. I stopped speaking. Got sick really bad. Thank God for my mother, who noticed the change in my behavior and basically said that she needed to go to the hospital. And when they tested my lead levels, they were through the roof. I had prolonged exposure to lead, and it impacted my neurological ability. In fact, I had to learn how to regain speaking from the time I was in first grade through the fifth grade through speech pathology. And so to be now a state representative, speaking truth to power about the realities that my mama faced and I faced growing up, living in those old homes with old furniture and how it impacts young babies, young minds, ultimately futures of Ohio. It is truly a blessing more than I can ever comprehend. And so, since I've been in the legislature, I passed a number of bills related to not just looking at lead from a macro sense, but also how do we really think about lead water lines? Ohio is one of the worst in the country. 750,000 lead service lines are still in use in the state of Ohio, and Columbus and Cleveland has the highest rates of children that are unfortunately diagnosed with lead poisoning. It's in comparison to any big city in the country. I think Chicago is probably one of the only other places that has more babies that have unfortunately had to navigate lead poisoning. And so when I was in office, as I'm in office in my freshman term, I introduced a bill that took ARPA funds, about $150 million from ARPA funds, to replenish a number of programs related to lead prevention and mitigation efforts. One of which was a program that was instrumental in supporting mothers who lived in homes with children that were discovered to have lead present, making sure that they received supports for hotel. Obviously, as you all know, when you remediate a home, those families have to leave the home, which is also another, again, cost for a family. This is why a lot of families have to make these very hard decisions as to whether or not they would even go forth with remediating lead in their homes. And so there's a program housed with the Department of Development and Department of Health in Ohio that help families with fiscal relief when there's lead present in a home and the home has a mother and the children. We were able to introduce legislation and pass it last GA that worked. This is all bipartisan bills, by the way. Everything I'm saying is bipartisan. Unlike Michigan, I'm in a super minority, and it is unfortunate that uh, good bills die, unfortunately, in Ohio. And so it takes a lot of effort and a lot of work. Shout out to Representative Rogers for the work that she's been able to do in Michigan. It is really tough oftentimes to see these types of bills move, but we have made some progress, and I'm really excited about talking about it. So the second bill we were able to introduce and pass was related to utility companies, and so giving authorization for utility companies to put forth programs for the collective good. So, for example, if a utility company wants to remediate lead service lines, for example, from their rate base or rate payers, what they will do is spread that cost equally across all of the folks who pay into that service. Why is that important? The issue that we are seeing in some of these issues related to lead and water specifically is that you almost kind of playing whack-a-mole. When a child goes to a friend's house and the friend's house has lead tainted water, but your house doesn't have lead tainted water, and now the child's sick, now you're thinking in your mind is your house was a reason and the reason why your child got sick, but it really is the house down the street. And so one of the things we were trying to do is we're trying to, as a community good, make sure every single house that a child will go into has clean water or has homes that are remediated. That's a common good for everybody. And so this legislation that's now law allowed us to build these programs out through utility companies to remediate lead lines across an entire neighborhood. That's the type of work that we have to do to remove this scourge once and for all from our communities. And currently, I have a bill called the Lead Line Replacement Act. I introduced it this GA. It essentially, over the next 15 years, would remediate all 750,000 lead service lines that still exist in the state of Ohio. The one thing I want to say is the EPA under the Biden administration proposed rules where we are there is now a timeline, a window of time where states would have to remediate lead service lines. And Ohio, again, because we're an older, all this is around infrastructure, we're an older state, we have some of the most in the country. And what we essentially did was paired what the EPA put out in the rule and codified in the statute in Ohio Revised Code, or at least through this bill. Because what we don't want to see is policies change and shift depending upon who's in office. The truth of the matter is these lead service lines carry tainted water into neighbors' communities, daycare centers, what have you. We have to remove it. And once you remove a lead service line, it's gone. I mean, the economic benefit that we saw doing our research on this bill was for every dollar we invest in removing lead service lines, we get up to a $34 of economic return on that investment. And so the economic argument makes sense for us to do this work. And so I am working every single day to try my best to not just bring my lived experience to the State House, but also formulate bipartisan policies that we know will ultimately lead to better outcomes for our children and families. And so the last bill I'll introduce and say is a bill to look at how do we increase the number of testing amongst our young people. Currently, we are seeing some of the highest rates of, again, lead poisoning in Cleveland. But the truth is, we have lapses in our testing model in the state of Ohio. And so, again, shout out to Representative Rogers for thinking strategically about broadening the testing landscape. We want to do the same thing here in the state of Ohio because no child should be living with lead unbeknownst to us. We should be providing resources to these families, to these children when lead is present, but we also got to catch it first before it's too late. And so happy to be on with all of you. Shout out to the parents for your diligence, for your voice. You remind me of my mama, and I would not be here had it not been for her um, seeing me and saying that something's wrong with my baby and I got to get you help. And now I get to do that for other kids. So thank you all for having me.
Thank you, Rep. Jarrells. We totally appreciate you joining us and sharing your story as a lead impacted individual as well. And so you being able to share your own personal story with your colleagues is extremely powerful because you're the voice for Ohio. So thank you for all your work. The next representative that we have is Assemblymember John Rivera from New York. Welcome, Assemblymember John Rivera.
Hi, everyone. Thanks for having me. It means a lot to be able to hear the stories with people that are doing the same work and are like-minded and prioritizing this really, really important issue. The truth of it is we're facing a lot of misinformation around there about how lead is already something that's been handled, that it's already been taken care of. Um, Hi there. Yes. And, at the end of the day, we know that it's not true. We know that we have to continue fighting this fight. We know that there is a serious, overlap between communities of poverty, where there's high communities of other health risks, is where you'll find lead. And for me, Buffalo is the city in this country with the oldest housing stock. And it is a problem that is uh, far too close to too many people, and we all know somebody in where I am that's been affected by this. And I'm raising my daughter in one of the highest lead zip codes in the state, and unfortunately, too many other parents can say the same thing. So we've proposed two big bills that we've been able to pass in the state assembly. And for reference, in New York State, our legislature supermajority in the assembly, supermajority in the Senate and also a Democrat in the governor's office. And you know, the first bill we have is to essentially provide for tenants the ability to seek damages against a landlord's insurance policy. In the 90s, four governors ago, put in a one sentence exemption preventing people from being able to do that. And this bill would essentially correct that forever. And then the second bill requires lead inspection, lead testing by a certified lead inspector uh, before any real estate transaction, with very, very few exceptions. So, we know where lead is. We know where lead is in what homes, because sadly, we treat our children like canaries in the coal mines, where we don't really think about it until we see a negative test. And, then we know, well, that's where the problem is. But, until we get to the point where we're proactively testing as many units as possible, we're going to keep running into this problem. So both those bills have passed the state assembly multiple times. Sadly, they have not gotten out of committee in the state Senate, despite our supermajority. And I think it's a reflection of, influential interest in the insurance industry and in the real estate industry. But, it doesn't mean we stop fighting. We keep fighting. We're bringing more and more attention to these issues. And, we're going to keep doing it. So thank you for including me. And thank you for all the work everybody does here.
Excellent. Thank you, Assemblymember John Rivera, for all of your work in New York and for advocating for these bills. Um, so just a quick break, just to share with you these last 20 minutes and what it's going to look like. So next, we're going to go into our question and answer led by Melissa Cooper Sargent, my colleague, and Mary Sue. And as I mentioned, we are going to try to get through as many questions as possible from the chat. After that, about 5 minutes to 7 o'clock, or right at, 2 minutes to 7 o'clock, we'll have to stop because we're going to allow Jamila Mon to do the closing out comments. And then she's going to take us into our after hour activity, which to me is super exciting. So we hope you all can stay on just 15 more minutes if you can. So take it away, Melissa and Mary Sue.
Thank you so much. And thank you so much to our panelists for sharing all of your experiences and all the work that you're doing, both from as parents and as lawmakers. And it's great to hear all of the action and the experiences across state lines and how we're all working on the same issue. And I think we can learn from each other and become stronger that way. So again, thank you everybody for being here tonight. Mary Sue, we had some questions that were sent to us ahead of time as people were registering. They sent in some questions. Would you like to start with those?
Sure, sure. And there are several categories of questions. Some are directed more to individual actions, and I know we can also discuss that, and some are more for the legislators on long-term policy and funding. But let's start with the questions for the parents. And again, thank you so much to both of you, Darlene and Robin. Very briefly, could you each mention 2 or 3 steps that a family can take to keep their own children and house lead safe?
Um, for what I recommend is for testing to be done, a lead blood test. That's the only way to know. So always ensuring small children are tested. I recommend, with our lead crisis being as high as it is in Ohio, and what I'm getting from collaborators I have around many states, is almost get our kids tested before one, because they're on the floor. The dust exposure is occurring before one, hands to mouth by them crawling and different things of that nature, getting closer to floors. So the testing is one big recommendation, because that's the only way to detect our children are poisoned.
Thank you, Robin. And Darlene?
I would definitely say I'm going to back everything Robin said. And then I'm going to say, I know it's hard, especially with toddlers, because they're running everywhere or whatever, but constantly keeping their hands washed. Constantly. I mean, if you're going to the park, if you have to, again, I don't know, if you have a lead service line, maybe you don't have bottled water, but at least even putting you some soapy water, maybe even in a bottle, something like that, because I know in upstate New York, perfect example, I was teaching my kids about growing fresh fruits and vegetables out of our own backyard. Unbeknownst to me, there was lead in the soil. So I don't know. I kind of went, I don't know, it was like a little backwards thing or whatever. But once I started learning, I became very good with keeping, anytime I seen dust, I would kind of freak out, which is a little crazy because that's kind of like saying kids kind of can't play because we know they cause, traffic coming in and out. But I was more so worried about keeping them safe. So I would say that. And also, don't just go off of the recommendation that the health center and the nutritionist give you. In your state, please look up, there's advocates everywhere. Look up those advocates, connect with those advocates, because I know when I first found out that my kids were poisoned, I wish I would have had the me that I am now to help guide me through it, because I went through a lot just by myself as a parent, not even speaking about trying to help my children. But as a parent, I went through a lot of mental health issues because I felt like I failed as a parent, because your number one job, right, is to keep your kids safe. So I would definitely say reach out, not to just the health department or the WIC department. Ask when you go, hey, do you know of anybody that's advocating for lead or anything like that, or whatever the case is, and get connected with those families as well.
I was
Can I say something real quick? I think too for this question, there's a lot of stigma that unfortunately is coupled with this particular issue. Oftentimes you think that, when families are navigating this, uh, folks think, well, your house is dirty or you're poor or like that like there's what I would tell folks who are on this webinar is we have to have a little bit more empathy and understanding the realities of what these families are navigating, right? These families are navigating old homes. That's it. Like they're not dirty homes. They're not homes in disrepair. They're old homes. And I think oftentimes if we can break down the stigma that's associated with children getting poisoned by lead, then parents will have much more of an understanding of how to navigate, because most parents won't even speak up about this because they don't want the stigma to be placed on them that they were somehow a bad parent. And so that is the thing I do want to share with folks on the call, because if we really want to change the conditions by which families are navigating, we have to change how we think about people who are navigating this issue.
And thanks, Rep. Jarrell. Adding to that, I would say as a parent, not to take the guilt and hold on to it because it's not our fault as parents. Our children became poisoned. As you mentioned, it's the environment, is something from man-made spaces that we cannot control as parents. But to get that knowledge, gain the knowledge, hear about this subject, and do your own research.
Great. Well, thank you both very much for those comments. I'm going to ask a question of to the legislators on our panel, and that's around, you've talked a little about the legislation you've put forward. What about funding in your state? How are you seeing going forward the state, especially with what's going on federally to some extent? How do you see the state helping with funding, or is that a barrier?
Is there anyone who'd like to take that question just due to time? And then after that, we'll take the next question.
Rep, you want to take it? Because my state's a little bit different than Michigan.
Rod?
You want me to go?
Yeah.
Okay, so Ohio is in an interesting space, you all. Again, I'm in a minority, but yet we're making miracles happen every day in my district, but also with the work I'm doing in the legislature. We actually saw, unfortunately, dollars cut in our last budget related to lead prevention services and lead abatement projects. And so, for example, with the Department of Health, who oversees a lot of these programs, we zeroed out their funding. We zeroed out our part of our H2 Ohio funds that helped facilitate some of these supports. And I ain't gonna lie, I'm pissed as hell. I'm just gonna be front. I'm not happy about it because I know that equates to people dying and folks falling through the cracks. And so one of the bills that I'm working on is to restore that funding and really bring to bear the conversation of, well, if you don't believe children are actually being impacted by lead, say it to my face. And so the one thing that I will say about funding, though, on a macro level, is there's never enough of it. This is an infrastructure issue. That's what we're really talking about, right? It happens to impact families, but we're talking about old infrastructure that we should have remediated a long time ago. And so I believe that it'll take to, for example, it'll take about $4 billion to remediate all the lead lines in Ohio. 4 billion. Now, we put forth $4 billion of projects for a lot of things. And so the money is there, it's the will. And so that is the work that doing right now as a legislator is thinking about how do I translate the economic vitality that happens when we invest in something like lead remediation to my colleagues who believe in scarcity minds, who have a scarcity mindset, right? Like how do I help them connect the dots that what we're doing is that common good is going to pay economic dividends for the foreseeable future. So we never have enough money. There's always finite resources. We always make hard decisions when it comes to things like our budget. But I think the work that we're doing to convince legislators of the importance of this issue literally means people's lives are being saved. And I'm willing to do everything I can to make sure we save lives.
Thank you. Melissa,
Uh,
you have a
If I
next
can jump in
question.
real quick, I'll
Oh,
just say for
absolutely.
the filter first, we did get $50 million earmark in the state budget for putting the filters on all children's schools. So I try, as coming from local government myself, I try to not do unfunded mandates on people. So that was really important that we were able to get that $50 million earmark for the filters for the schools. Um, and the other piece is that I've been a huge advocate locally, and then also encouraging the state to have local matches where it's possible for lead line replacement because it is so expensive. So we put up some of the money in the state budget, but then we ask locals to match some of it where they can.
That's great.
Thank you. Thank you both. And there is some comments in the
Sorry, I'm
comment
sorry.
section. Oh, yeah, go ahead.
I'm sorry. Before y'all move on, can we allow the rep from New York to be able to answer that same question, please? Because I would like to know that as well.
Yes. Assemblymember Rivera, are you still with us?
I don't
I
think
think he left, if I'm not
Okay.
mistaken.
Yeah, I'm not seeing him on here anymore, so um that's unfortunate that he's not able to answer that question. And I was going to say that there's a fair amount of comments saying that New York does need to collaborate and learn from what some of the what Michigan and Ohio and some other states are doing. So, and that's part of what we're doing here on the call is making these connections. So I am hearing that and I'm seeing those comments in here too, for us to uh, come to New York or at least have conversations with folks in New York to um, there was a said we need outside people from outside the state who have come up with solutions to end their lead crises to come to New York. I don't know that anybody has ended their lead crises, but there's progress. Some progress is being made. Um,
Brittany asked a question, Melissa, or she's trying to ask, and she's saying, I have a question, but not sure how to ask it. Take it away, Brittany. You can definitely ask the best that you can, and we'll help guide the best we can as well.
Brittany, are you able to type your question into the chat? And while Brittany is doing that, we have a question about what is a parent in Michigan to do when one lead abatement program does not account for the complete lead-related needs in a home with a toddler with elevated lead levels.
Yeah, that's a really difficult question because the abatement can be pretty expensive. We do have some state grant funding set aside for such projects, and then we also have local dollars from some county, like Kalamazoo County, my county was able to get a federal grant for a couple years in a row, but that depends, of course, on federal government and they're now right now shut down. So it can be a little bit chaotic, but oftentimes county health departments have a lot of those resources of who's got the grants available. So I do encourage you to reach out to your local county health department to see what grants are available to help. But I do understand what you're saying. The cost of doing the abatement can be really pricey.
You're getting some appreciation in the comments section, Rep. Rogers, for your work advocating for lead prevention. Okay, Dorothy is asking, the New York rep said that he and his family live in one of the highest lead hazard areas. My question to him is, how is he protecting his children from lead poisoning through paint, soil, and water?
Can I?
But
He's not here to
yeah,
answer
I'm
that
sorry. So
question,
yeah, he
Dorothy.
is gone. So sorry about that.
He's gone, but I do want to say something. And this is again, there's 40 folks on this call. Some of us are on the panel. There's a couple of things I want to leave people with. One, I think every single child, we should normalize that lead is a part of our life. Like, as much as we try to say remediated it, it's gone. It's not gone. It's still here, right? So please, I don't care if you bought a new home. I don't care if you feel like you got the cleanest drinking water, it's so fresh and lovely and spritzy. Go get tested. Test your kids, test your water. They actually have take-home tests where you can put the water in and you can put the little sample and it can show you exactly what your lead level is in your water. Go get a filter. I have a Brita filter in a brand new apartment complex, right? I still use a Brita filter because it's not because I don't trust my water necessarily, but I just want to be better, right? There are other contaminants like even the 3.5 millidecimal liter. First off, I want zero point zero of lead in my water, right? And so if that means getting a filtration system and being intentional about where my kids go. I don't have any kids yet, but I will be really intentional using and having sanitizer, wiping their hands, right? Like just be proactive. Just your house. It is the community that your child lives in could have presence of lead. It could be your auntie, your grandmama, your uncle's house, your cousin's house, right? Or their cousin's house. So while lead, you can reduce the amount of lead exposure in your home. The truth is, as long as there's lead in our entire community, your child is never safe. And so just be proactive. And we got to normalize that this is real and put forth measures to protect your children and get them tested.
Thank you so
Thank you so
much.
much. Okay. Melissa,
Uh,
do we have time for one more question or
Yes, I'm
comment?
I'm seeing something about decision makers and lawmakers. Are they thinking about their own children and their own family members? And we hope that they are, and but that is why we do feel strongly that lead is a bipartisan issue. Everybody is affected by it. Lead does not choose, it does not pick. It's just anybody can come in contact with it. It doesn't matter if you're in an urban area, a suburban or rural area. Old homes have lead paint, there's lead in soil, there's lead in water, so it is a bipartisan issue. So we do hope that Congress people and lawmakers are thinking about everybody's children and not just their own when they're making these decisions. Um, and then there's another question in the Q&A that's asking about paint manufacturers and if they have been held accountable. And I do know in the past there have been proposals to have a paint tax and one way to hold paint companies accountable. Um, but n that has not moved through Michigan, and I'm not sure if it's moved through any other states. I think New York maybe had been entertaining that idea as well at one point. Um, I don't know if anybody wants to address that. We do have 5 more minutes, or if there's any other questions coming through the chat that are appropriate.
Go ahead,
I
Rep.
can
Rogers.
Yeah, I can jump on the paint tax one real quick because that was my first term. We included that in our package, and it had a lot of opposition. I'm a glass half full kind of gal, and so I think something is better than nothing policy related to get passed and over the finish line. And so we did take that bill out last term because it seemed to be one of the more controversial pieces of the package. And we were able to get, our bill package all the way through to the Senate and then ran out of time in lame duck. So I think the paint tax is a good idea. It's just it does tend to bring out like the retailers association and the manufacturers and et cetera, et cetera. Whereas I think a lot of these other concepts that Rep. Jarrell's and I and Rep. Rivera were talking about have more bipartisan support.
Thank you so much for
Thank
that.
you.
Um, Mary Sue, I see you have your hand up. If you speak loud and clear,
I'm going to
go
speak.
ahead.
Can you hear me? I can speak in as loud as I can. I
Okay.
wanted to let everybody know we'll follow up with an email, but the Blue Green Alliance has a discussion this Wednesday on Rep. Joe's. You'll be interested on it about Detroit, Chicago, and Milwaukee on lead service line replacement success and challenges. Wasn't sure if people knew about that. That's Wednesday, October 22nd at 10 a.m. Central Time. And we'll make sure to send that out to everybody through an email. So
Thanks,
just a
Mary
shout out
Sue.
to that group.
Uh, there's
Excellent.
there's one more comment, and thank you to Tracy Gregoire of the Learning Disabilities of America, for posting in our chat that we can see, commenting that the state of Maine has a 25-cent per gallon fee on the sale of paint, that's imposed on manufacturers and wholesalers, and that money goes towards funding the lead poisoning prevention fund. And the fee is paid annually by the brand owner and is intended to support lead poisoning prevention programs, and there is a low quantity waiver for those who sell fewer than 1,800 gallons in Maine per year. So thank you,
Thank
Tracy, for
you.
that.
Well, thank you. And Melissa and Mary Sue, thank you so much for leading the chat discussion. It is 6:58, so I'd like to remind everyone of that. We do have more questions coming through in comments, and we are definitely going to find a way to get answers and follow up to those of you who are asking. We have your emails and contact information. So I would like to introduce you to Jamila Mon from Healthy Homes Coalition of West Michigan. Take it away, Jamila Mon.
Thank you, Melly. I am so thankful to be here kicking off Lead Poisoning Prevention Week. As it was mentioned before, in about 2 minutes, we'll have some structured, just networking, chatting, get to know folks around you. So if you want to stay on, it'll be about 15 minutes or so. Before we transition to that, just a few reminders that I like to share. Again, as our panelists have already discussed, lead is still very much a serious issue. It's an ongoing issue. It is 100% preventable. And we share that as we're engaging with stakeholders, whether it's community members, policymakers, anyone that is interested in hearing more. It is 100% preventable. Testing, early intervention become equals better outcomes. So there are often times that children do not show symptoms, and so testing is the only way to know. Collaboration is essential, and that's a lot of what this webinar, one of the purposes of this webinar is bringing folks in the same space despite where they are geographically, but hearing what others are doing, hearing great things in their community, also understanding the gaps and perhaps bringing that back to your community to do things differently. Equity matters. So we know that lead exposure proportionately affects low income households and marginalized communities. Um, and addressing lead is an environmental justice issue. You're not a part of the solution. So the work continues after today. Stay connected. We know that when you sign up for this webinar, you have the Ecology Center contact information. If not, go online, sign up for their newsletters. After when we do that structured networking session, you'll be able to perhaps get the email address or contact for some other folks. And yes, set up a meeting, stay connected. Before we wrap up, I just want to again thank everyone. Thank the panelists. Thank you, Robin, Darlene, State Representative Julie Rogers. I'm in Grand Rapids, so perhaps we can meet up at some point. You're not too far from me. Assembly Member Jonathan Rivera, we know that he signed off early, and then also State Representative Dontavius Jarellis. So thank you all for your advocacy, your expertise, most importantly, your work in protecting families, advancing lead-safe policies, being transparent and vulnerable, and sharing your experience, your stories, and what brings you to this space today. Yeah, stay connected. So if you are interested in staying on for, like I said, about 15 minutes or so, just stay in the chat. For folks that have to take off, it was an absolute pleasure in having you join today. Thank you for your attendance. And yeah, hopefully you were able to get a lot of good information out of the webinar.
Thank you so much, everyone.
Thank you, everyone.
All right. All right, Jamila, we'll take it away. What do you got
Yeah.
for us?
Let's do that, Mary Sue. Sorry to change it up on you guys, but if you are comfortable muting yourself, say your name in a space or issue related to lead that either you work in, you advocate for, you're passionate about, either you're working on it now or perhaps you're interested in getting in that space. So,
So
Robin, oh, I'm
I'm
sorry.
just going to say I'm going to have to unmute people. Sorry for all these obstacles to being.
Okay.
So
You.
raise your hand and then I can unmute you.
I don't
Yeah.
know if we're
Thank
going to
you.
see people raising their hand other than the presenters.
Mm,
Like I'll raise my hand, but
yeah.
So I've seen, hopefully, Melissa, it's okay to keep going.
Okay,
I've seen
Angela.
if,
Okay, I'm
well,
going to unmute Angela.
Angela says her hand is up now.
Okay, great. Thank you. Thanks, guys. Oh, I see hands up. I see hands up.
Can
Thank
you
you.
show our video too, Melissa, or
No, that this is working. Go
it's
for it.
working? Okay.
So we've got Tanisha, and we've got Angela, and we've got Emma, Bernard. So Melissa will proceed to unmute you. Just give her a sec.
Yep. All those who have raised their hands are now unmuted. Thank you.
Woohoo. Okay, thank you.
Hi, this is Angela. Can you hear me?
Yes.
Yes.
yep.
Yay, it worked. Hi there, I'm Angela Medina, and I work for Michigan's Childhood Lead Poisoning Prevention Program. So, really just a really uh, passionate about everything. So, any issues or new things, the latest we've been talking about is unique sources of lead exposure that have been popping up. So, always looking to network and hear from parents and advocates as I work in the state.
Thank you, Angela. Thank you. Thank you.
My name is Dorothy. Can everyone hear me?
Yep.
Yep.
Just a quick question. I'm a lead inspector, and I know that since the Flint water crisis, they've made filters available to families and whatnot for drinking water. But what about bathing? To me, and I might be speaking out of turn because I have no idea of the process, but to get filters for drinking water, but they're still bathing in lead poison water, that doesn't quite make sense to me. So are they being helped with filtering their bathing water as well?
Can jump in on
Ms.
this one.
Rogers.
This is Rob Rogers. So, yes, my understanding is that to your point, bathing is a huge problem in the prolonged exposure to the water. I actually had this very interesting experience. I was at a conference um shortly after I want to say it was like 2 or 3 years after the Flint water crisis, and this woman was telling me that like she was a lawmaker too, and she was telling me that she was told by her physician to set a timer and to only take showers for 5 minutes. And so once her lead
Oh my
line
God.
got replaced, it was a habit she had to actually break herself of. And the first time she took a shower for like 20 minutes, she was just crying tears of joy that she could finally bathe without this 5 minute timer. And it was very shocking to me.
Wow.
To your point, I think what's best practice and recommended is to have whole, and it's always where's the funding and where's the money, but whole house filters
Yes.
are the standard, but that isn't always what's affordable. But yes, to your point, bathing or showering in lead tainted water is a problem.
Oh, so the families that have the lead poisoned children, they aren't given whole house filtering? They're expected to pay for that themselves after the children have been poisoned?
I would say it's community by community.
Wow, gotcha. Thank you so much. You can go ahead and return me to mute. Thank you so much.
Thank you, Dorothy.
No problem.
All right, Jamila.
Yeah. Any other questions? Bernard, Tunisia,
Yeah.
Emma, before. Oh, yes. Bernard.
Hi. Yeah. My name is Bernard Apia. I am assistant professor in the Department of Public Health at Syracuse University.
Mm.
I am more of like a health communication specialist, and so I design communication interventions to address public health issues, including lead poisoning. And one of the things that I have found based on a few studies I have done is that it appears that the media, in terms of how they have been covering lead poisoning issues, there aren't a lot of media coverage on the issue. So some of the research I do, I examine how, say, for example, newspapers have been reporting on it. And so I am looking to partner with institutions to help ensure that we can implement advocacy and engagement interventions to help address that. I also happen to be the chair of the Let's Safe Coalition, which is the Central New York coalition, and I happen to be the chair for education, engagement, and testing committee. So I'm very excited to be part of this meeting. Thank you so much.
Thank you.
We're excited to have you here, Bernard, and hopefully the start of, yeah, ongoing relationship with the Glenn Network.
Thanks.
Emma. Okay, we'll keep going on. Emma, if you still have a question, put it in the chat. Just let us know. We'll unmute you again. Tanisha, hopefully I said that correctly.
That's
Tanisha?
fine. I've been going through that all my life. Hi, everybody. Um, uh, I work with D-Led, a parent advocacy group in Detroit. I was listening to the lady from New York, and I would so love to connect with her. I would so love to connect with her because I do a lot of advocacy here. I think I can, help her out a little bit. But I do have a question for Rep Rogers. Um, what about when the kids age out? My grandson is now 13. So he gets pretty much no help. He has an IEP, okay, yeah, but realistically he doesn't get, you know what I'm saying? Like there's nothing for older people, older kids. Once you got past what 6, 7 years old, it was pretty much no help. So how can we do something for the kids that have tested with the elevated blood levels? I've actually met you, so I know that we're on the same page.
Yes, thank you for the question. So I think it depends on like what you're looking for. The early on program is only through age 3. But Medicaid does cover therapies, whether it be PT, OT, or speech, throughout the lifespan. So if there's deficits, you can work with the school to provide, some of the therapies at the school setting, but you might need outpatient services overlapping with that. So I'm not sure, like, if you can be a little
Not
bit more
all of us
specific.
are on Medicaid. That's why I was one of the people that was really pushing because I mean, I worked at Ford Motor Company all my life. You see what I'm saying? So Medicaid was not in my household. Not everybody has Medicaid, but I do understand what you're saying as far as, like I said, with the IEP, yeah, okay, but realistically, they don't, it's not helpful enough.
Or I would also encourage people to reach out, through primary care if you do have commercial insurance. If you do have insurance, oftentimes it's kind of how it's documented what the deficits are. I will quickly share that I have had several patients of my own that the primary care did not pick up on the symptoms and they were not keyed into that it was lead causing the neurological symptoms. So I think sometimes, unfortunately, you do have to be your own family's advocate and kind of be a little bit aggressive and pushy and be that voice. I also have continued to uplift with our local county health department to get the word out, and our county health department does have a lead nurse that tables at different community organization meetings. And I think the advocacy and you all that are on here are so helpful, and because it literally takes all of us to try to get the word out and talking about this. And I really will echo what the representative from Ohio was saying, is that there's lead everywhere in even though some of us may not be testing positive for it today, you could be exposed. And so that's kind of been my mantra, is making sure that my colleagues from a physical therapy standpoint are looking for this and questioning things. And when something doesn't add up, or when someone is not progressing in rehab to the level that they are usually, to refer back and refer back and refer back, and making sure the testing is done. So I know that doesn't exactly, get at everything you're saying, but you do raise some good points about we need to continue to uplift and advocate with the insurance companies, with the medical providers. Another thing I want to just say also, that not everything always needs legislation. So when I was first looking into this, I had the pleasure of worshiping at my house of worship with the head of a local hospital, the head of pediatrics. And so I was challenging this head of pediatrics to look into the number of children that were being tested, and it was pretty low. And what he was finding was the providers, the nurse and the doctors, were skipping through the medical fields and the electronic medical record and the computer. So sometimes they've got oodles of questions to get through in that pediatric check, and they're not always asking the screening questions. And so he met with the IT people, and I thought this was a really creative solution. He got the computer guys to not allow them to advance through the screen without asking the questions and the lead screening questions. And so just that change of the computer medical record forced the practitioners to be asking the screening questions, and they ended up screening and testing more children just from that change.
That's so important. Thank you.
Yes.
Thank you.
There's four. Emma
And
is now ready, and there's three other people with their hands up. Are people able to stay on a little longer still?
Oh, hi, this is Devin. Can you hear me?
Go ahead, Devin. Yes, definitely.
Hey, good evening, everybody, and thank you so much for organizing this webinar. So my name is Devin Payne Sturgis, and I'm an environmental health sciences professor at the University of Michigan School of Public Health in Ann Arbor. And I just want to say that I'm really, really moved by the stories that were shared, by the parents, and it's really great to hear Robin speak again. I've known Robin now. Is it going on like 2 years? But I just want to just comment that, I'm really interested in, any action to help move policy towards more primary prevention, getting lead out of the environment instead of simply only relying on testing of kids. And I'm also very interested in how can we think about better translation of some of the current and really interesting public health research that is being done on the lifelong impacts of lead exposure. You know, effects in adulthood, effects around cardiovascular effects, or cognitive decline. Wondering about how that information can get shared better out into the public, into the hands of policymakers, decision makers, as a way to think about motivating, policy change. And maybe it's also around, as the other gentleman was making the point of, an economic argument. Because as we learn more about these health effects, it is possible to also talk about what does that mean in economic terms to our society. So those are just my comments. Thank you.
Thank you for
Hi,
sharing that.
hi there. This is Emma. May I speak now?
Yeah, yep, go right for it,
Okay.
Emma.
Thank you. Thank you. I had responded in the chat to a concern that was expressed earlier regarding a lawsuit, and everyone says a class action lawsuit. That is the last thing that you want to file because the attorneys take their monies off of the top, and what's left is distributed amongst the clients. My suggestion is something that is not often used because attorneys withhold it, and that is called a mass joinder lawsuit. Every person's name is mentioned in it, but you file it as a separate yet individual lawsuit. Is filed into a single case, and I hope that I'm making myself clear here. There can be 1,000 litigants, but only one case will be filed with all of those names. And because of the structure of that mass joinder lawsuit, it is totally and is handled very, very differently as it works its way through the courts, as opposed to the common lawsuit. Um, so if there are questions on that, I'd be happy to entertain them. Otherwise, I'd like to go on and express my thanks to the organizers and the panelists of this webinar, having talked not recently, but within the last, let's say, 10 years. I filled in for a friend of mine who needed a few credit hours to complete her master's in science, and I volunteered and learned at that point the difference between led a child who had been, it's very emotional for me, so I have to calm down a minute. I learned the difference between a alcoholic fetal syndrome child and one who was a child who had been exposed to drugs in the womb and a lead poison child. All of the attention and monies were directed towards the child who had been exposed to drugs and the one who was a alcohol fetal syndrome child. Nothing was said about the lead. And here this year, the CDC even shut down the lead division, eliminated all of the staff. And I'm saying, since Robert Kennedy says he has people available in another section of the CDC, which he has not shared, that these people have been assigned to a program in HHS to continue the work. I think that we need to bombard his office with letters saying, where are these people? You have funds available in another program for lead. Where are the people? Why can't we find out who they are? I think we should all act like hockey moms, suburban hockey moms. They're the only people in the United States that frighten me. They get what they want because they collectively organize and they don't back down. And that's what my suggestion is. And thank you for listening.
Thank you.
Thank you. Okay, we have maybe a few more minutes left. I see Tracy and Robin. Um, yeah, and then we'll go from there. So I think Tracy, perhaps your hand was up next. Would you like to go
Yes,
next? Okay.
yes, thank you. I'm Tracy Gregoire with the Learning Disabilities Association of America. And just so folks know, like we're part of the Great Lakes Lead Elimination Network. and have affiliates in most states. So would welcome anyone reaching out to us, and we have other great partners. It's true that each state is at different places when it comes to this lead work and what laws are in place. All states can improve what they're doing. And I would encourage everyone to make your voice heard. You don't need stats and figures. What really makes a difference is personal stories, whether it's lead or other issues that are important to you. So I'd encourage people to get involved, to let their legislators know that this is an issue they care about, and encourage other people to speak up. And certainly any of us can help with kind of looking at what's already in place in your state and kind of where your state can go to better protect children. And the last thing I'll say is get all kids should be tested. I've heard just horror stories about people being told, oh, you're not in the high risk area, so you don't need to get your child tested. All kids should be tested. That's a rule in my state, which happens to be Maine. And I coordinate other state affiliates, but I know in a lot of states that's not true. And testing more than once. If you feel like your child or grandchild or a friend's child, right, is showing signs or you have concerns, right, testing again if that's needed. So sadly, sometimes the physicians don't ask everybody or encourage people that live in certain areas over others, but I think it's just as we've said, it's 100% preventable. Trust your gut, get your kids tested, and educate others as well.
That is so true.
Thank you, Tracy. Robin?
Am I on? Hold on for a second. I'm sorry, guys. I can't see. Hold on. Okay, I am on. Sorry about that. One, I just wanted to say thank you all for putting this together. It has been such a joy to sit here and see it, the finalized product of what you guys did, bringing this on. Also, I was going to reach out, Devin Church Payne, who was just on, is a partner of ours, but she definitely want an introduction to the Ecology Center, to continue to work on like some of the things she said. She's at the University of Michigan, and we utilize her as partners in our studies and some of the things that she offered, bringing the aspect of the dollar and tying that in. And that's some things we're working on here in Ohio. So just wanted to give a plug for Devin to, I will introduce to Ecology Center. She will share herself with us, with the family support groups as well, if they want to do some things with University of Michigan.
We really welcome that. That's very exciting. Thank you so much, Robin.
Thank you, Robin.
They were systems.
Oh, sorry.
Go ahead.
No, go ahead, Robin. I'm sorry.
Go ahead.
It's a little bit of delay on my end, so I apologize if there was continued conversation. I also just wanted to plug Robin, Melly, the ecology team. There is also a parent group that meets once a month that is led by Robin, and the folks at the Ecology Center, where it is comprised of folks all over. So Michigan, New York, Ohio. And it's really the time and space to build that fellowship, that community, talk about ideas, talk about what's going on in your community or you personally. So, Melly and Robin are the contacts for that particular program. And in the follow-up email, we'll include the logistics of that. I thank everyone for joining. Hopefully, I was able to call on everyone that had their hand raised. And have a wonderful evening.
I saw LaToya.
Hi, I just had a comment from earlier. My name is
LaToya.
Hi, my name is LaToya Jones. I'm the director of Lead Safe CNY Coalition in Syracuse. And I know there was a mom that was talking about like IEPs and those things as well. So I also have a son that is a traumatic brain injury survivor as well. So what happens with the IEPs in the schools, there's still like with kids with lead poisoning, there's a gap. There's an education gap with the teachers because the teachers don't know what to look for. So the older kids are having behavioral issues and they blame it on other things and they don't really test for lead. So here locally, I've been working with our coalition to start to think about how one, do we educate those older kids on lead poisoning? But also how do we educate the educators and then the parents to advocate? Because now when you're dealing with the IEPs and OPWDD, now you're also have another layer of stress dealing with the disability and the disability system. So I would say a couple things. We are working with the schools to try to continue to educate their teachers. So we go in on like parent nights and those type of events to educate both. And then as far as, like the OPWDD disability stuff, that's just like another legislative battle, trying to make sure that your child is getting help because their disability came from lead. So I would say I'm open to chatting with you on how we have started tackling those systems. And then we also have tried to start in a preventive way, right? So instead of always being responsive, we want to be, we want to prevent things. So we develop with our family advisory council support, we developed what is called an early warning system. So I partnered with the Dolly Parton Imagination Library here in Syracuse, where they have access to over 16,000 kids. And kids are enrolled in that every time they're born. So with that, the Dolly Parton staff in our local area, they call the parents, they make sure they're getting their books and, checking to see, well, you live in a high risk area, would you like the staff at Let's Say CNY Coalition to call you? Are you interested in getting your paint tested and your water tested? So when they say yes, they are linked to social care navigators that work with me within the coalition. And then those folks are linked with the county or they are linked with the city for water testing. When what we do is we try to stay in the loop so we can make sure everything was done for the family and they know all the resources, then it's like a closed loop system. But dealing with like disabilities and IEPs and OPWDD and the lack of education for educators is a huge problem. So I would suggest the possibility of working with one of your school districts to put together some curriculum for teachers when they have training.
That's great. Thank you.
Right on time at 7:30. Thank you so much for this wonderful conversation, and we really appreciate everybody so much for joining us and for participating with us tonight. And the recording will be available, and we will send that out to everybody who registered for the event. Thank you again, and have a wonderful evening.
Thank
Thank
you.
you.
Thank you,
Thank you,
everyone.
guys. Bye bye.
Bye.
Thank you
Bye.
so much. I
Thank
had a
you.
pleasure
Thank
working with
you.
all of you and planning, and thank you
Bye.
so much. I really, really appreciate you all.